What are the side effects?
I think the side effects is being that you just can't eat some foods you used to eat. And the most common would be steak and cold white chicken out of the fridge and some breads. Now, if you take the average punter in the street and tell him, listen mate, there's no more steak for you, it's over, and he didn't have a band in him, he'd look at you like you're nuts. But the difference is, once the band's in there and working, you just don't care. But I think that's what most people are anxious about long term is, how am I going to be if I can't eat a steak? Well, I used to like the steak as much as the next Aussie. You know, we're meat eaters. And I really was anxious about it, but I just don't care. And I can go to Peter Luger's or Sparks or Ruth's Chris, and everyone will be eating their huge steaks, and I'll just have either a piece of salmon or a piece of trout, something like that, and I'll be happy as Larry, you know. But so that fear doesn't translate into reality long term once you have the band in place. We don't see malnutrition ever. We never see it. We occasionally see iron deficiency anemia in heavily menstruating women because they just don't eat as much red meat. And so some women will, and we probably would advise a woman in her 40s to take a multivitamin with iron. There is no evidence that younger people need to take that, but there's no harm in taking, you know, a multivitamin a day with some iron. That's really the only nutritional thing. One great benefit of this from a long-term point of view is that women can have babies with this band in very, very safely. And both Paul O'Brien in Melbourne and I have both published big series of women who've had bands in place, who've had babies, and we've looked at how they've gone, how this pregnancy compared to previous pregnancies they had when they were obese, checked the comorbidities attached to the pregnancy, and how the babies were, and we found the mothers had the same weight babies as before. The mothers did not get blood pressure or diabetes, and they had very happy, safe pregnancies. So we're really comfortable using this device in women who are going to have babies, and I'm very comfortable to leave it inflated during the pregnancy as long as mother's having no problems